The surgery was planned but necessary. Without it, I could not live normally. The pain was constant. Medication did not help. The doctor said it directly, either now or it will get worse later. I agreed. The money for the surgery was collected over a long time. Part was my savings, part was borrowed, part was help from close people. I did not ask for extra, only to survive and get back on my feet. Before the surgery, I paid everything for the ward, for anesthesia, for medications, for an unofficial payment. That was the condition. Without it, nothing moved. The surgery was done. I woke up in the ward. The pain was strong. I could not stand up. I could not walk. I could not even hold the phone properly. I was completely dependent. At that moment, I had no income, there was no job, no sick leave was paid, all expenses were on me. The people who promised to help after the surgery disappeared. At first, they did not answer calls. Then they replied briefly. Then they stopped responding at all. I needed to buy medication every day. Some of it was mandatory, otherwise there would be complications. I counted every unit of money. I chose what to buy today and what to delay. After a few days, I realized there was no money at all. Not for medicine, not for food, not for transport home. I lay after surgery and counted small bills in my wallet. I wrote to those who knew about the surgery, to those who said, "Don't worry, we'll support you." The answers were the same. "It's hard right now." Later. "I don't have money myself." "You'll manage somehow." One said directly, "That's your problem. I was after anesthesia, with stitches, with drains, with a fever, and without money." The nurse said that additional care had to be paid for, otherwise no one would come. I stayed silent. I had nothing to pay with. Food was brought to other patients by their relatives, not to me. I ate hospital porridge once a day. Sometimes I did not eat at all. When it was time for discharge, I was told, "You need to pay more." I said I had no money. I was told, "That's not our problem." I sat on the bed and could not stand up. They said, "Then you stay here, but it will be more expensive." I called everyone. No one came. No one sent money. No one showed up. In the end, I left the hospital barely standing, without money, without support, with a bag of medications that I did not know how I would keep buying. On the way home, I felt bad. I sat down on a bench. People passed by. No one asked if I needed help. I reached home, I lay down, and I understood. If something goes wrong now, no one will help. The following days were the same. Pain, cold, an empty refrigerator, a phone with no replies. I sold things, first electronics, then clothes, then things that had value only to me. For almost nothing. I could not recover properly, because recovery required medication and food. I had neither. People who knew about my condition lived on, went to work, drank coffee, laughed, posted photos. I lay and stared at the ceiling and counted the days so that it would not get worse. I understood one thing. After surgery, you become unnecessary. While you are strong, you are respected. While you pay, you are listened to. When you are lying down and cannot give anything, you disappear. This is not a story about pity. This is a fact. I was left without money after surgery, deliberately, calmly, without explanations.